Good morning. Welcome to Pet Patrol, Protectors of the Pack. This is Alan Braslow, your host. I have the privilege today to be once again with Phil Barnes, who is the marketing director at NorthStar, and Dr. Dan Stobie, who is, I guess, the founder and the director.
Founder and chief of staff, yeah.
And keeps us all out of trouble. This is who I would call if I, probably now that I have his email address, he'll be getting a lot of emails from me asking questions. I'm going to start today's session off a little bit uniquely in that, as most of you know, I'm a very big fan of NorthStar. They have done wonderful things for my own dogs, for our rescue dogs. As far as I'm concerned, if you're in the South Jersey area up to Trenton, there is no other rescue, there is no other 24-hour specialty hospital to go to. These guys are the best. So I wanted Phil to start off and kind of give the commercial side of it. And then we'll get into some interesting questions with Dr. Stobie.
Yeah, so NorthStar VETS is a 24-hour veterinary specialty and emergency hospital. We have two locations. Our main location is in Robbinsville, right where 195 intersects with the Turnpike. And we have a clinic in Maple Shade, which is right at the intersection of routes 38 and 73.
It's right in the Lowe's shopping center. I'm very familiar with it.
Yep, and so those are both 24-hour facilities. Our specialists rotate through. So if you need emergency care or specialty care, you have both options available to you, whichever one's more geographically convenient. The phone number to reach either location is 609-259-8300, and you can always get information about us at northstarvets.com. And for people who really like great stories, we're doing a lot of great things this year on our Facebook page and our website. We're capturing all of these really cool cases. The kinds of things that our doctors are doing this year are just incredible and worth talking about. And so we're capturing some of these really interesting, really fascinating stories, and we're putting those online. So pet owners out there, if you like the fascination of veterinary medicine, how it's growing, if you like to hear great stories about pets that are beat the odds and did well, continue to check out the website and our Facebook page for all of that.
Another thing you want to do too is when you go to the page, take a look, because I'm setting it up with my dogs to do blood donations. As much as we don't realize it, when dogs and cats are in surgery, sometimes they need blood as well. And with larger dogs, not the small ones I was told, but the larger dogs can donate blood and they can help their fellow dogs.
That's right.
And there's some advantages for everyone else as well if they bring their dog in to have that done.
Yeah, yeah, it's a great program. The dogs and cats who come through and donate blood actually can save another pet's life. It's really incredible.
So, Dr. Stobie, I always ask the question because I know we all, as we're growing up and we figure out what we want to do in life, it doesn't always go in that direction. Mm-hmm. At one point I was going to be an actuary. Thank God I didn't make that mistake. That would have been a disaster. I went in a different direction. But how did you become a veterinarian? What drove you into this profession?
I have always, ever since I was a little kid, always loved animals and always was around them. My mother would go crazy because I was bringing every stray creature home that I found on my way to school. And as I went through, schooling, I always had a very strong interest in biology and science and medicine. And so veterinary medicine was kind of like the perfect merger between the two things that I love the most, which was science and medicine and animals.
Now, how long have you been a vet?
I graduated from veterinary school in 1990, so
a couple of years.
27 years.
And by the way, that's one of the things I love about NorthStar. There's a lot of experienced vets. That I found. When I've been forced to go to other places. There's nothing about learning. Vets need to learn, but if it's my animal, I guess I'm kind of selfish. I want to go somewhere where there's a lot of experience. And are most of the folks on staff like yourself? They've been doing this for a while.
Yep. All of our doctors are boarded specialists in a certain area of veterinary medicine. And then our emergency doctors are very experienced emergency doctors. We don't have interns or residents. So in that sense, we are not a true teaching hospital, but we do take veterinary students that rotate through, that spend time with the specialists, observing what they do so that they can learn. We always have visiting students both on the veterinary student side as well as students that are in undergrad that are interested in veterinary medicine, and technicians that are veterinary nurses. But if you bring your pet to us, you'll definitely see a very board-certified specialist who's been doing it for a long time. You're not going to be seeing somebody who's in a learning position.
That's interesting. I was thinking as you said that I had to bring one of my dogs in, and it's exactly the environment that it was. The lead vet, there was another veterinarian who spent a lot of time listening
Mm-hmm.
and observing,
Yep.
which is made me feel very good that they were listening and observing, and the senior vet was the one who solved the problem,
Right.
of course.
Yep.
Now, you founded you founded North Star, and what is your day like? Do you have to do administrative work, or have you been able to push that aside somewhat and actually see day-to-day cases?
Well, I'm a surgeon. That's my specialty. So that's what I do is surgery. And you know, when I started the practice, most of my time was spent doing surgery all day long. As the practice has grown and we've added other locations, my job has shifted to doing a lot more administrative work. But I would say that about 25% of my time is still clinical, and the rest of the time is spent, you know, managing the hospital.
I bet if you could, you would make it 75%.
Yeah.
25.
Yeah, when I'm in surgery, I'm in my zone. Nobody's bothering me.
And you can
That's
and
where I'm
save
the-
lives.
That's where I'm the happiest. So for sure.
Now, when doing surgery, do you do generalized surgery, or do you have any specialty area that that you enjoy doing?
Well, all of our surgeons are trained to do all types of surgery. So we do um, the big categories are orthopedics, which is bone and joint type surgery, neurosurgery, which is of the spine and brain, and then what we call soft tissue surgery, which is all the internal organs. So spleen, liver, heart, lungs, etc. And then there's plastics, which is all skin stuff. So all of our surgeons are trained to do all those things. However, we all have kind of our area of expertise or areas that we may have additional training in or that we're more focused in. And so for myself, it's more in the orthopedic. I do all the joint replacement surgery at the hospital and a lot of the arthroscopy and things like that.
Interesting. I was just told we have to take a quick commercial break, and then we're going to come back. And I want to ask more about the joint replacement surgery. My wife just went through a knee replacement 3 weeks ago. Probably I should have come to see you because she's still hurting right now. She'd be better off this way. So we're going to take a quick break, and we'll be back after this commercial. Welcome back to Pet Patrol, Protector of the Packs. This is Alan Braslow, your host, and again, I'm with Dr. Dan Stobie and with Phil Barnes from NorthStar. We were having a fascinating conversation during the break, and I figured let me bring this topic up. You mentioned about joint replacement surgery and arthroscopic surgery and minimally invasive.
Yes.
Tell the folks the story about that shoulder surgery you mentioned years ago, what it would have been and what it is today.
Yeah, so veterinary medicine has advanced a lot, just like in human medicine, and a lot of the things that are done for people now, we do the same thing in animals. And what I was explaining to you during the break was when I was a resident, there's a certain type of shoulder cartilage disease that young dogs get. And back in the day, to repair that, we'd have to actually, you know, surgically open the shoulder joint, remove that diseased cartilage, try to replace it with a graft, and it would take it was a very painful procedure. It would take the animals 6 to 8 weeks to recover and even start using the leg relatively normally again. But now we are able to do that whole procedure arthroscopically, which is where we take a scope, just like in people, and has a camera on it, and we can look inside the joint. There's little tiny hand instruments that we make little just pinhole incisions, go in, are able to remove the diseased cartilage, replace it with a graft, resurface the joint, and many times they'll either have just 1 or 2 stitches or no stitches, and they're usually using the leg. They're a little sore, but the next day they're using the leg like they barely even had any surgery. So it's really been miraculous and has helped, you know, improve our quality of care, increase the recovery time, and certainly decrease the discomfort that the animals experience.
Interesting. Another question I had for you, because we were having that discussion earlier. One of my dogs wasn't feeling well this morning. That's the nature of the beast.
Mm-hmm.
What advice do you give folks as to when they should pick up the phone and call you folks? It's a weekend. Typically, their family vet is not going to be available. And when do they not wait and call you?
Well, we always recommend that they see the family veterinarian first if the family veterinarian is available, because that's kind of your first line of treatment. And we have a very good relationship with the general vets, and we're kind of an extension of their practice. So, but if they are unavailable after hours, or the animal is showing, has a high fever, having uncontrollable vomiting, seeming very lethargic, meaning that they're weak, they can't get up, they don't want to eat, or one of the big indications of a serious problem is, an animal's gums should be nice and pink, just like ours. If they're very pale, then that can be a sign of a serious problem, and that would be the situation if your family veterinarian is not available, that you should call one of our emergency facilities so that we can see your pet right away.
Thinking back about some of the situations you've had to handle, are there some that just you'll never forget?
There's always those cases that are very memorable, and the great thing about veterinary medicine is that it's every day's different. It's never boring. It's always challenging. I learn something new every day, and I think the variety of species that we see. I mean, we primarily do companion animals, dogs and cats, but we also have some good relationships with some of the zoos in the area, and like Six Flags Great Adventure, and so being able to work on some of those animals is very interesting and challenging, and also good for our staff because it kind of mixes things up, and there's always a big crowd around when a tiger or something comes into the hospital, and very challenging.
Tell me a little bit about when a tiger comes in. I guess I'm a TV junkie when it comes to veterinary medicine shows, and I watch Dr. Paul, and God bless him, his arm is usually stuck in the place I don't want to be.
Yep.
But have you had experiences like that where you've actually had to, with large animals?
Yeah, I mean, all veterinarians have to go through that through their training.
Really?
So we all learn how to do all those things in veterinary school, and I've had my arm in many places as well through my training. But then as you start to specialize in an area of veterinary medicine, we don't really do farm animals, really, although our ophthalmology department still will service a lot of the horses in the area. We have a relationship with the equine specialty clinics in the area for doing eye surgery on the horses, because that's a very specialized area of veterinary medicine.
I think that's the end of the horse I would want to be operating on. I'm not so sure I'd want to be on the other end of the horse.
But they don't like having their face messed with, so those can be challenging cases.
Yeah.
And many times, just because horses tend to be head shy anyway, the ophthalmologist will put in these cannulas into the eyelid so that the person who's taking care of the horse can actually, from the back of their neck or from their mane, they can squirt the eye drops in that way. It's a tube that goes in.
Oh, that's neat.
Because horses don't like having their face approached or having you put something in their eye. So we have to come up with these creative solutions to be able to treat our patients, because it's not like a person where you can tell them to hold still or open your eye or sit there for a second. So
they may not listen to you, and
may not listen to us, and you can get seriously hurt by a big animal like that.
Interesting. Now, you folks have grown from Hamilton down to Mount Laurel. Any plans in the future of expanding anywhere else?
We do have some other future plans for expansion in different areas that, I think that there's a need for our services. But, as we do our planning, time goes by, we add things to the list, and there will be more to come.
I'm trying to think, there was another question I wanted to ask you, and it slipped my mind for a second, but again, getting back to the memorable animals, the things that will stick with you, where you saved a life and it was one of those big challenges. Any?
I think one that's very memorable for me is this little dog that was a companion for a handicapped person that was wheelchair bound, and the dog ended up getting hit by a car and had quite a lot of damage to her pelvis and her lower spine and all, and it was so important to get this animal well and rehabilitated. It was a little Bichon that would ride around in a wheelchair with this lady, and it was not only her companion but a service dog for her as well. And so being able to get that animal back to health, and just seeing like the joy on that lady's face when she thought she was going to lose this dog, those are things that are very rewarding, and that is why we do what we do, and stick in my mind of things that the reason why we get up in the morning.
Interesting. when you were talking about the arthroscopic surgery, it was making me think that, and as you said, there are a lot of changes that have taken place, similar to what's happened in human medicine and veterinary medicine. Phil had mentioned to me a while ago about new hip procedures that it's just fascinating that you're doing, and a patella study, I guess it was, you talked about, and some other things. So
Right.
maybe, because hopefully everyone will find this fascinating.
Yeah. So most people think of hip dysplasia as being, I guess, the biggest problem orthopedically that dogs get. But even more common is they tear the cruciate ligament in their knee. That's probably the most common reason why we see a dog for lameness issues, and we do quite a few of those procedures every day. But in the realm of hip dysplasia, which is pretty common in a lot of dogs, especially large breed dogs, where they're born, where the malformation of the hip as they age, they get a lot of arthritis in the hip. It's very painful. They have trouble walking, and back at years ago, there wasn't a lot of hope for those animals. Many of them got euthanized when they were too painful or couldn't walk anymore. Then a procedure was developed where just the head of the femur was removed, and that eliminated the pain, but didn't really give the dog a good function to its leg. So we are able to do total joint replacements now, or hip replacements in dogs, just like they do in people, and it's just amazing to see them get back to normal function, have a pain-free hip, and they can run and jump and play like they did before.
Interesting. We're going to come back to this because I want to ask some more questions about the different joint replacements and other areas that you're involved in. This is Pet Patrol. We're going to take a quick commercial break. Can't speak today. Commercial break, and we will be back in a couple of minutes. Welcome back to Pet Patrol, Protectors of the Pack. This is Alan Braslow, your host. Phil Barnes, Dr. Dan Stobie. We want to dive deeper into joint replacement. It's how it compares to what's going on with people, and then get in maybe to the patella study that you were talking about during the break.
Yeah. So the hip replacements, what we do is we actually replace the whole, what's called the acetabulum, which is the cup that holds the head of the femur in, and we replace the whole head of the femur. So it is a complete, true joint replacement. And we're working with some of the implant companies on developing a newer implant that's more similar to like what they're doing in people now, where it's more of like just resurfacing the femoral head. So it's a little bit less invasive, a little bit less traumatic for the animal, because the old implants had to be put down into the shaft of the femur,
Right.
and this is more just the top part of the bone. So it's a new procedure. We've just started doing some of those, but we are continuing a study where we're trying to enroll pets to get a lot of those cases under our belt and see how they do.
What type of pets would you be looking for? Because I'm sure there's folks out there who are having dogs with hip problems,
Yep.
hip dysplasia problems.
Well, it's usually a large dog problem. So it's usually the medium and large and giant breed dogs that we're looking to do this in. And for this particular study, because it's a new procedure and it relies on, we're not using any artificial other than the implant itself. We're relying on the body for the bone to grow into this implant. So we're kind of limiting it to dogs 5 years of age and under that. We know their bones are going to be strong and healthy. Well, some of the older dogs get osteoporosis just like in people, and so we have to use bone cement to rely on the implant staying in the bone. But for these younger dogs, a lot of the implants have gone to what we call cementless implants, where the bone will actually grow and incorporate into the implant incorporates into the bone, and so we're to, I guess, give the animal the best chance for eliminating all of our variables. We're trying to limit it to dogs 5 years of age and less.
It's absolutely fascinating. It sounds like I'd be sitting with a surgeon, a human surgeon, talking about bone replacement, hip replacements, or knee replacements. It's the same thing. I had a German Shepherd many years ago that had hip dysplasia, and it reached a point where there was nothing left that you could do for her.
Yeah. Well, now there's lots of things that we can do.
That's amazing. What about the patella study you were talking about?
Yeah, so patellar luxations are where the kneecap, just like in us, should stay in the middle of the knee. And in a lot of dogs, they get what we call a patellar luxation, where the kneecap is actually popping off to one side or the other. It doesn't stay in the middle. And so that causes pain and lameness and also weakness in the leg. So there's a certain syndrome that large breed dogs can get. It's called patella alta, where the kneecap rides too high on the instead of being right in the middle, it's more up here, and there's nothing to keep it in place. And there weren't really a lot of procedures available to correct that, but we developed a procedure at the hospital to try to fix that, and did a study to see how it would work, and we've had really good results with that. So we're actually starting a phase 2 trial of that this winter, and going to be looking to enroll some of the smaller breed dogs in that as well.
I actually might be able to help you. Dr. Lisa Miller from House Paws.
Mhm.
She did the physicals in December,
Mm-hmm.
and we have a dog that we rescued at 6 months old. He's a little over a year now. He was feral, found in Puerto Rico,
Mm-hmm.
and she says Poppy has his patella
Yep.
flips off,
Popping out. Yep.
and he's only 20 pounds. So I may have a small dog for you.
That would be one of the
may
ones
have
that
one.
we'd want to get in the study, because we know it's working in the large breed dogs. We didn't have the saw blades that we needed for these smaller breed dogs, but we worked with one of the implant companies to get the right size. So now we want to try to see how the small dogs will do with this procedure.
We'll definitely have that conversation after the show's over. Looking to the we talked about looking to the future. We only have a couple minutes left, so what I'd like to do again, because as you folks have probably picked up, I am a big fan of NorthStar VETS, and I want you to know who to call and why to call. So Phil, you can't just sit there and be a pretty face. We're going to let you share share again. Tell everybody about NorthStar.
So NorthStar VETS, 24-hour veterinary specialty and emergency hospital. 2 locations. There's one in Robbinsville, where 195 and the Turnpike intersect, and the one in South Jersey is in Maple Shade, where Route 73 and 38 intersect. You can reach us at 609-259-8300, and you can find out more about us at NorthStarVets.com. This is a hospital that has more than 40 doctors on staff and more than a dozen different specialties available. And we work in partnership with the family veterinarians, so we're an extension of their practice.
And if you go to the website, I found there's a lot of really good information. If you're trying to understand more, I mean, had we not met today, I wouldn't have known about the patella study, and we were talking about my small dog, 20-pounder, who when he had his physical, he's only a year old. He had his physical because he has a patella issue. So don't just sit out there and think that you know what's wrong. Do a little research. Also, they can email questions to you, I believe. Do you have a way to contact on the website?
Yeah, on the website, there's a chat feature. So if you don't want to call in, you can actually chat with us and ask your questions, and our client liaisons there will answer you back, get the answers you need, and help you out.
Very, very good resource. It's good when your family vet is not there, or maybe it's not a specialty that they're in, to have someone that you can reach out to, who in a non-threatening way is going to reach back out to you and give you some ideas as to how you can address the issue. So want to thank all of you for joining us today. I hope to have some more of the vets from NorthStar VETS back on the show again real soon. I always enjoy this type of interview. I tend to learn things that I didn't know about my pets before. And we will see you on the next show. Again, this is Pet Patrol, Protector of the Pack. Alan Brassler, your host. Dr. Stobie, thank you very much for coming. Phil, thank you very much for being back again. It's good to see you.
Thank you.
And folks, we'll see you again next time.